welcome to the third installment of this masterclass in myopia management. I really appreciate everyone who has come to all three. You know, people ask me, why is it on Sunday morning? The reality is I'm just like you. You know, I see patients through the week, and when I come home, I want to spend it with my family. I don't want to stay up and give a webinar. So I really appreciate everyone, especially Megan Schoenfelder. She is the executive director of the Academy. She gets up at 7 in the morning and she hosts this webinar. She sends out all the emails. So thanks so much, Megan. So if you missed the first two, or just to review, I started with marketing. You know, how did I build a practice that really gave me and my partners a wonderful life and continue to give me a wonderful life? And I mean, not only financially, but also personally. And that's the God's honest truth. So we talked about acquiring quality referrals in the first webinar. That's very different than advertising. You know, advertising is you put an ad out there, you put a Facebook ad, you do some funnel advertising, and you get people to call your office. That's very different than how I teach my system. The way I teach my system is when the phone rings, the patient is ready to make an appointment for either an exam or a consultation. That's what I mean by quality referrals. They've been educated by someone in the field, an influencer, a mom, a dad who says, hey, go to Dr. D's office. That's special. And then the second webinar last week, we talked about what makes sense for you. And that is huge. It's not what makes sense for myopia management. It's what makes business sense for you and your practice. And sometimes we look at our competition, our colleagues, or sometimes insurance companies to determine our fees. But I outlined my approach to determining fees, and I had so many questions afterwards. I tried to address half of them directly, and I'm going to address one that I thought was most relevant this morning. Today, I really do feel the most important webinar is leadership. Today is patient and staff management. Why do I say that? Is the system I presented to you, this masterclass, if you will, depends on two very specific things: that your patient experiences the same excellent, repeatable experience every time they enter your office. If they don't, those referrals will not come to your office. It doesn't matter how inexpensive you are. It doesn't matter how expensive you are. If your patient doesn't experience a repeatable, enjoyable experience when they come to your office, all bets are off. And who does that? Is staff. And especially in this day and age, if you don't know how to hire and train staff, what happens is they're delivering the care. We can only salvage so much in the exam room. It really depends on our staff, the person answering the phone, the person who does the preliminary testing, all the way to the person that waves goodbye. Depends on how that patient is going to refer to you. So that's today's webinar. So before I begin and people are filing in, I had a really good, insightful question last week. They said, hey, Dr. D, when you presented these fees, these sample fees, was that for a 1 year or 2 year? And another question that I got was, is this for a hired doctor or a partner? And I want you to get a very good understanding of this calculation. It's just a sample. You have to speak to your CPA, and they can tell you pretty quickly what is your chair cost. In other words, how much do you need to generate in an hour to cover your costs, everything except your salary? And in this fictitious example, it was $200. And I said, usually it's about a 2-person practice, depending on where you practice in the world, and also depending on the quality of your equipment and things like that. But let's use $200 an hour. In my office, and what I taught last week is I spend 1 hour in the consultation, and then I spend the first year, this is where I'm answering the attendee's question, 6 follow-up visits that are 20 minutes each. So to the attendee and to all of you, it doesn't matter. If you have a 2-year program like I do, I just add 3 more visits. So in this example, I would add another hour to it. So instead of a total of 3 hours, it would be 4 hours. So really, this example is used so you're determining fees that make sense the way you want to deliver your care. I noticed in the OrthoK blog, some doctors are 3 months and done. I don't know how they do it, but they're very good ODs. So their chore cost is very different to deliver care than me, who has a 2-year program, and this doctor has a 3-month program. The majority of practitioners, I'm going to guess, have a 1-year program. But even then, some doctors see them several times in that 1 year like I do, and other doctors see them very infrequently. So if you're competing with your competitor and they're delivering different service than you, you're going to lose. The bottom line is my system works if you deliver the care that you feel is most important and you charge accordingly. So let's go back to the first webinar. If you recall, on marketing, my practice was very busy the first 4 or 5 years out into practice. We were grossing almost $1.5 million. I think we were approaching our 10th year in practice. That's all we wanted. That was the goal, is to gross $1.5 million. We were very busy. At the height of our practice, we were 6 weeks booked out as far as exams. And what we noticed, my partners and I, we had 2 partners at the time, me and Barry, and Ivan was coming in, is that our gross was high, but our net was not high. And sometimes what didn't make sense is our practice was earning, let's say, $1.5, $1.4 million. And yet at the end of the payroll week, sometimes we didn't have enough money to pay ourselves. Something did make sense. Just as important is that we weren't happy. My staff was unhappy. I remember firing my staff and saying good riddance and hiring new staff and said, this time I'm going to get a much better quality staff, and never panned out because there were some core issues that were at the root of the problem. And it wasn't my staff. It wasn't my patients. It was me. And Barry, about 1999, 2000, stumbled upon this book, Building the Happiness-Centered Business or Practice. And it was this dentist that I introduced to you in past webinars called Patty Lunn. And he talked about something that was just foreign to me, is build a practice that brings you happiness. What we have thought about the first decade was build a practice that brought you money, that paid for your bills, that paid for your family, paid for your house, paid for your staff. The concept of happiness, we just assumed would happy with increased happiness. So in this particular case, Patty over here, Barry brought him in. We listened to him for a year in his recordings. I just found this book today. I kind of pasted it because I found it on Amazon. It's $88. I don't know if the book is $88, but it changed our life because we would buy into Patty's system and listen to his recordings. And slowly but surely, we indoctrinated his philosophy of quality patients as opposed to quantity of patients. And I summarized this at an academy meeting a few years ago when I gave the keynote speech to the OrthoK Academy. And I've talked about the different needs and wants. You know, what are needs and wants of patients? Remember, patients want good visual acuity. Patients want myopia control. Patients want to be seen on time. But what they need is an empathetic doctor that spends time with them. And they put a tremendous high value on that as time. But when I got into optometry, I really didn't understand the difference between my wants and what my needs are. And this is critical to being successful in private practice or in life, I'm going to say. So when I became an optometrist, I had 2 pretty specific wants. My want was I wanted to earn enough money to buy a house, maybe have a summer house, pay for my kids' education and weddings, have a nice financial lifestyle. I never dreamed of owning a yacht or flying a jet somewhere here or there, but I definitely wanted financial security. The other thing I thought I would get was professional fulfillment. I think people would respect me as their doctor. My staff would respect me as the owner. And slowly but surely, as we were reaching that 1.5 million mark, I wasn't getting that. My financial security was not that stable. It really depended on how well that month did. Even though my costs were so high, I couldn't gross enough. I couldn't net enough, I should say, to cover my expenses sometimes. Didn't make sense. And the second thing was professional fulfillment was going down the drain because I was increasing my capacity to see from 2 exams an hour to 3 exams an hour to 4 exams an hour to 4 exams plus 2 checks. So 6 patients an hour. And that was my capacity. But you know what happened? I noticed my staff wasn't respecting me. They were burnt out. My patients weren't respecting me. They were out in the reception area waiting a long time. And insurance companies that I was trying to appease were not respecting me. They were, we talked about it last week. My fees, or your fees, I should say, if you accept Medicare, according to the AMA, have gone down over the past decade, not gone up, especially when you take into account inflation. So what I didn't understand with these needs, what did I need? I wanted respect. I became an optometrist, a health provider, because one of my highest values in life is respect and appreciation. And the last thing is autonomy. I wanted independence. That's why I'm an independent practitioner. And I wanted personal time with my family. I came from a hard working class family, very low income family. My father worked, God bless him, 7 days a week. We never seemed to see him. And the worst part about it is we always seemed to be in financial straits. So what I wanted to do is to have a profession where I spent quality time with my spouse and my kids, because that was something that I missed in childhood. But as I accepted more and more insurance companies, what was happening was the complete opposite. The way I think insurance works is you accept a reduced fee for increased capacity, volume of patients. And in return, you hope those patients get commodities from you, whether it's dry eye or glasses or contact lenses. And maybe that worked my first 10 years of practice, but I'm going to tell you now as a seasoned practitioner, that model doesn't work. And we'll talk about it more when I talk about staff. And this has nothing to do with optometry. This has everything to do with healthcare workers. Here's a quote from Elizabeth LaRusso, MD, a Harvard-trained psychiatrist specializing in physician wellness. She says, how can we take care for patients? How can we care for patients if nobody cares for us? The answer is we can't and we aren't. This is huge. When we're so focused on pleasing everybody around us, specifically our family, insurance companies, our patients, we have no bandwidth to take care of ourselves, to take care of our family. Consequently, throughout the medical profession, the degree of emotional issues that we have as a profession, healthcare professional, has never been higher, because we all enter healthcare to be good practitioners, to be selfless. And something has gone awry, because outside people, whoever that is, industry, I don't know, leaders, MBAs, have now employed us in one way or another and have told us, we're going to take care of you. And for me, that hurt, because my autonomy, my level of respect and appreciation went out the window. The way I teach this course and all my courses is, the answer is to discover, what do you value most in life? And it's different for all of us. Sure, all of us say family and quality time and this and that. But if everybody's value was just family, we wouldn't have Amazon. We wouldn't have Tesla and PayPal. We wouldn't have so many big businesses and politicians, because although they may value their personal time, they may value something like power a lot more. So what has gone awry, I think, in healthcare is that we get out there and we think we're good entrepreneurs and want to build these massive industries, multiple locations, so we can gross high and get good at billing and coding. The reality is we're physicians, we're optometric physicians, and we're not built that way. And if we are, it still sacrifices a tremendous amount to get there. So I start with all my workshops is what is most important in life. What most people do is start in the top, the daily task. What do I have to do today to grow my practice? What do I have to do today to get through the practice? And then you never feel fulfilled. And that, I think, is a key ingredient to my success. If you remember, I have one practice, 6,000 square feet, 4 partners, 2 residents. We all have a beautiful life. We see patients 3 days a week if we're partner, except our youngest partner. And we work on the practice the other days with the 2 optometry residents, have a wonderful experience and don't get overworked. So I've built a practice that's based on profitability, but more importantly, on giving me and my partners and my staff a great life. So, all right, Nick, that's fine. But how do you obtain quality referrals? Like, what are the systems? What are the patient systems that get you or get your patients to refer to you? So you have to wow your patients. You have to be good at what you like to do. So patients on the soccer field, in church, at WeChat, on Facebook, talk about your practice. That's how I picked my orthodontist. So many of the systems that I've implemented in my practice through the years is because my kids needed braces. I didn't know where to go. At the time, we're going back probably 20 years. Braces were somewhere between $4,000 and $8,000. I didn't know where to go. What did I do? I asked a neighbor. I asked a friend who I respected, maybe an influencer at the time. And they said, go to this place. And I went, because when it comes to my children, I don't want to skimp. It's different with me. I can skimp on myself. That's fine. But with my children, I just don't skimp. And sure enough, the experience I got at this orthodontist was the same experience as my friend who referred me there. And I've referred so many others to this orthodontist. Do I get spiff? No. I'm referring friends and family because I want them to have the same positive experience that I had. And it had very little to do if my children's teeth are straight. I wanted straight teeth, but what I needed was to know that my kids had a wonderful experience while they were there. So how do I wow my patients? How are you going to wow your patients? It's very simple, but it's not easy. Number one, I do a consultation, and I'll take you through how I ramp up to my consultation so people sign up or enroll in my program after the consultation. I do amazing things during the consultation. The insertion removal or application removal class is huge. That is what I call an inflection point. If you don't handle that well, at worst, the person's going to drop out. At best, they're not going to refer family to you. The mom is going to probably insert, or the dad's going to insert and remove the lenses, and they'll get through it. But it's not going to be a wow that they refer friends and family. And I follow up after each visit. So really, it's 3 steps, right? There's 3 touch points: the consultation, the insertion and removal class, and every follow-up visits. And if you remember, I see patients quite often, maybe more than many of you, because I view it not only as good care. I check their lenses, I check their VA, I check their axial length, but it's a key opportunity for me to remind parents why my practice is different. So the first thing I do, if I'm doing a routine exam, I need to spend a minute to explain to the parent how terrible the child sees. It doesn't matter if it's -1, -5, -4. So what I do is I put up the Big E or an Allen chart with a birthday cake or a big bird or whatever the case may be that corresponds to what I know the patient may be struggling with. So the patient is -2. I may put a -150 or -2 letter up there. And when the child struggles, the parent who's in the exam room is saying, what the heck? You can't see that? If I feel I still haven't gotten engagement from the parent, I'll have the child switch seats and I'll put the parent in the exam chair. And if the child is -4, I'll take a trial frame and I'll put +4 there. And I say, this is how Johnny sees when they don't wear their glasses. So I want the parent to know how terrible the child sees uncorrected. Now, I do this 40 times, 40 myopes, 40 patients to get one in the exam into the consultation room. But it is worth it because that one consultation reaps several others, as we're going to talk about. So that's the first thing I do during a routine exam. I make sure the parent understands how lousy the patient sees or the child sees. If the parent starts crying or looks emotionally distraught, I say there's a good chance they're going to transition into a consultation. If I see the patient, yeah, that's how I see, they'll wear contact lenses, just give me a script. I'm going to get him at Costco or online. I know I'm not going to spend a lot of time. I'm going to give a great exam, going to update their glasses and their contact lenses. And you could see why I felt I was too good to accept all these plans. I'm not telling you to drop plans. I'm just saying, be yourself and say, are the plans I'm accepting me reimbursing me for the quality of doctor that I am? That's all I did. And when the answer was no, I dropped them. It wasn't easy, but I did. Also, before the consultation, during the routine exam, I review the history. Your child's eyes are worsening. The prescription, I go over my objective findings, went from -1 to -175. And I recommend a consultation to see what are options. I don't talk about corneal reshaping or atropine or soft multifocals, just like I do for anything else. If I find something like glaucoma suspect, I don't panic. I don't go into this whole explanation. We got to order some tests. And during the test, we're going to find out what is the proper diagnosis and what options we're going to decide. And then I pass the baton to a scribe that's in my room or to someone that makes sure that patient follows up. This is something I instilled during the pandemic, and I still do it today, 3 years later, because it reaps so many rewards. Everybody who comes to see me was not from an ad. It was from a friend or family member or a doctor that was referred to my practice. So I set up a 20-minute virtual call. And during that virtual call, I get the child's history. What age did they start wearing glasses? What are the parents' visual history? Is the dad -7? Did the dad start wearing glasses at 6 years old or 16 years old? In my opinion, it has a big difference. What are their online habits? Are they tethered to their phone? How sensitive they are. Do they cry every time you put allergy drops in or have a conjunctivitis and the mom has to struggle? And I do a Q&A. And the only purpose of that 20-minute virtual call is for them to know why their friend and family said, you got to go see eye care professionals. You got to see Dr. D. Because right now, post-pandemic, in your community, in my community, every good practitioner within the vicinity of your office is offering some form of myopia management. We talked about this last week, as they should be. The question is, why should they come to you? That's the question I answer. If it's because you're the cheapest, I think there's going to be a huge problem here. If it's because you're the best, and best means because I spend time with you, that's all I'm saying, is I really do care about your child, and I'm proving that by how much time me and my staff spend with you, then I think it doesn't matter what you charge. Remember Dr. Lamb from last week, I feel, and I've learned this from vision therapy, and I learned it from myopia management, specialty care, if you do it right, has no competition. So this is email I get July 11th. Dear Dr. D, it's so nice to talk to you. Thank you for the information, because I emailed them information after the virtual talk. We look forward to seeing you for Lily's consultation. We will watch the homework you provided, because depending on how that virtual meeting goes, I assign homework. Maybe this parent's asking me 101 questions about corneal ulcers and side effects, astigmatism post-ortho-K. side effects of atropine drops, whatever they I'll send them papers, videos, how to insert, remove lenses, maybe eye drops. And we're going to talk about that in patient management. They finally come into the consultation. And to be honest with you guys, my staff and I know what level we're going to charge at this point because I get such a good history. And we went over this last week. If they're -1 and 6 years old and -1 at 12 years old, we have two different cases, even if they have the same case. If one parent's -12 and the other parents have never worn glasses, it doesn't matter that their refraction's the same. They're two different levels. If they have the same parental history, the same visual history, and one child cries every time they go to the pediatrician or to the eye doctor, and the other one is pretty aloof, two different levels. So what do we do during the consultation? Preliminary testing, and we rehearse this because I need clean topographies. That baseline topography, as you guys know, are huge, but I don't want the kid to come into my exam with nail marks because the technician is taking topographies without gloves and really traumatizing the parent and the child. It's got to be done in a certain way. And I, of course, evaluate the fitting. We try contacts on or demonstration lenses. I make a confident recommendation. I'm not the type of practitioner that enjoys saying, we have three options here. We can do atropine, we could do soft multifocals, we could do something called orthokeratology. I strongly believe that after the consultation, I know what's best for this patient, taking into account many factors, including their refractive error and the child and things of that nature, and my own personal skills, what I'm going to recommend. Then I leave plenty of time for questions and answers. And then they go with my technician and they enroll in our program. And I always assign homework. And notice what words I use. Homework. This is not like eye drop practice. It's homework. And we're going to go into what homework we assign. During the consultation, I confirmed there's a problem and something needs to get done. So I said, Johnny was -1. They're now -175. They're 10 years old, 8 years old, whatever they are. We got to do something. I place the lenses in their eye. If I feel they're a good Ortho-K candidate, I strongly recommend Ortho-K. I discuss how Ortho-K works or how atropine works or how soft multifocals work during the consultation. I give light surprises. If there's one thing you learn as a reward for waking up and listening to me on a Sunday morning, is oftentimes the child's motivation to do myopia management does not parallel the parents' motivation to do myopia management. And if you don't get the kid on your team, you've lost. So you're going to be learning in the next 20 minutes or so how I get the child motivated on the parents' level, my level. So when I hear from practitioners that the kids don't take snacks, of course not. They know it's bribery. They know you're going to put drops and a lens in their eye. They're 7, 8, 9, 10 years old. They don't want anything in their eye. So our goodie bags are beautiful. They're all set up. I'll show you. I think I have a picture of how we set up our exam room and our consultation room. We have a dedicated staff members. You know, some staff, I would say the majority of my staff are not cut out for myopia management. I need funmeisters. I need staff that are tolerant of children and nervous parents. Remember in the first webinar, we talked about the demographic, and this is also a clinical pearl, is we schedule all the follow-up visits, the 1 day, the 1 week, the 1 month, the 3 month, at the time of enrollment. Why? Because I never want to squeeze them in. We talked about that last week. After the consultation, the same thing that I did after the virtual conference before the consultation. Whatever the parent was most concerned about, visual hygiene. Sometimes they say to me, Dr. D, the child reads, like slouched. The child reads on the bed, on the sofa. Is that important? I say, absolutely. And I have handouts and I email them. They may want to, they're killing me with so many questions about infections. And I tell them, if I tell you that it's safe in my hands, that's a conflict of interest. I'm going to send you published data that talks about the efficacy and the safety of cornea reshaping. And the authors often conclude it's up to 2 particular things: the experience and the skill of the doctor and the compliance of the parent. And I say, if you're compliant and I am experienced and skilled, the risk of infection is very low. We talk about sometimes the parent says, please, Dr. D, speak to my daughter. She's always on her cell phone. She's always on TikTok, or whatever the case may be. And then I send the child information on the addictive nature behind these apps like YouTube and things like that, and the effect it has on their brain. I talk about sleep. If this kid looks sleepy and it's Monday morning and they went to sleep at 11 o'clock and they're 8 years old, I know we have a problem. And they often ask me now, this is very different post-pandemic, is what lens are you going to fit them? I've tried atropine, and I have to educate them that the way I do atropine may be very different than the way you do atropine. That takes time. I have to tell them what lens I'm starting with and why. And even if it's the same lens as what you're fitting out there, I have to tell them why my experience, why my office is different than your office. That takes time. It's not because I can fit the same design better than you. It's what I can do. And what you can do is I can communicate very well with the patient during all aspects of the program. The other thing that I talk about a lot is the insertion removal, because a lot of you out there think once you get, let's say, 3 signups in a week, 3 signups in a month, 3 signups in a day, that now you're golden. No, the party has just started. What you have to do is now the hard work begins. You have to wow your patient at every step of every patient encounter. So for the insertion removal, because it is quite scary for children, I have to make sure before the INR that I'm training them, and I'll show you how I do that, during the INR class and after the INR class, because that's a golden opportunity to shine. Because I could tell you, having 2 kids who wear Ortho-K, that worn Ortho-K as little kids and continue to wear them at 7 years old, my wife, even I, was very anxious the first few weeks. So this is excellent advice for all of you that are out there. Before the insertion and removal class, we give homework. Remember, so what homework am I giving? I'm giving, and I'm going to show you the handout we give them. We train them at the end of the consult. If they enroll in our program, even if they don't at that time, I have a separate technician teach the child how to put lubricating drops in their eyes. Why? Because the technique is terrible. They get it on their head, they get it in their ear, they're scared, they close their eye, the mother has to pry it open. And I tell them, listen, you have to practice this technique 4 times a day. Listen to my language now. In order to pass your class, the word pass, no one wants to fail their class. And you have to do it 3 times. And my experience has shown, if you put these drops in 4 times a day, every day, and you get better and better and watch the homework we've given you, you're going to get an Amazon gift card worth $30. And I say to the child, do you know what Amazon is? I don't care if the child's 5 years old or 50 years old. They know what Amazon is. So now I've gained leverage. During the pandemic, before I was so busy, I would encourage you not to use the Amazon card. Ask the child what they really want. Usually it's something like a model, a high level, like robotic model, something like that. And I put in up to $30, $35. Some of these kids found a drone, I think, for $35. Lego blocks, books, it goes on and on. Because we're so busy and we do several insertion removal classes and several INRs and consults a week, that really the only way to standardize for my practice was an Amazon gift card, which took a lot of stress off of me and my staff. But if you're not as busy as me, remember, I see Ortho-K patients 5 days a week, every day, literally all 3 doctors. We see dozens and dozens of patients every day. This is all I do. So we have a protocol of how we not only order these Amazon gift cards, but we have, an inventory of them. So before they leave, they get something like this. They said, these are rewetting drops. There's no medication. They have a QR code that goes to a video. And so the child now has homework to do in the 2 weeks that it takes for me to design the lenses. This is critical because the more homework they do beforehand, the more successful they're going to be during the insertion removal class. And even before the class, we have Hannah email Stella and say, hey, my name's Hannah. This is very different. So now they know who the INR tech's going to be. I'm going to teach your child how to insert, remove their lenses. Hannah is a real person. She is an amazing individual. I've been in practice 30 years. She is amazing because of her patience with the children. She tells them their time of their appointment. They have to watch the videos of children putting in their drops. We also send some videos if needed of children putting in their lenses and removing the lenses, and they have to practice nightly. Now, she's saying nightly. I told them they have to practice 4 times a day. My goal, look at how she signs off. I give her the autonomy to cater these with my approval. My goal is to make your child's experience pleasant and informative. Already, the parent knows, okay, I'm in good hands. I'm still nervous. So this is how Hannah sets up her INR room. If you closely look, we social distance. We used to do 1 desk, and now we butt up 2 desks. Why? Even though COVID is 3 years ago and still present, we like to social distance. We don't wear masks, we wear gloves. So notice how she butts these 2 tables together so we get about 6 feet, give or take, between herself and the patient. She has the mirror. Look at the tissues. This is all before the patient comes in. Looking towards the right, that is a goodie bag of snacks to the right. I have no idea what's in that brown bag. I'm assuming she puts away the INR bag, the Amazon gift card that's leaning against the bag to the child. And look where the bag is facing. This is all standardized. It's facing the child. It is leverage, guys. It's the carrot. We need the child to know all they have to do is get the lenses in 3 times and take them out 3 times, and all that to the right of them is theirs. Look where their travel bag is and behind the mirror. This is stuff the child's not interested in. They have drops to the left of them, their lenses, they're all ready. I took this picture because we're going to talk about staff momentarily. I'm so proud of my staff, and I'll tell you how we got this great staff. So we got the SNAF, we got, the Amazon gift card, the snacks, and this is also worth getting up on a Sunday morning, is we've learned to ask the parent to stay in the reception room for the first 2 insertion removals, because as many of you know who are experienced, the parent's just there. They're getting the child nervous. They're getting the technician nervous. We have found, we say, listen, we're going to call you in for the 3rd insertion removal. You could videotape it. We just have found that if we work with them one-on-one, that it works out better and they will pass their course. And we give them over an hour. So we give them an hour to hour and a half to do all this. It's high stress. We use a high-level reception area, and the parent videotapes the final attempt. So after the INR class, that's when the party begins, because you guys know that there's going to be issues that night, if not that night, the next day, the next 2 days. So we email them right after the course, videos to watch that reviews what they were taught, and the doctor calls or emails the patient, which is standardized. So Hannah now is following up with Stella. I'm emailing you to see how Stella did with her lenses last night. This is automated. She does it during the INR, actually. Hopefully everything went well. If you have any questions or concerns, please do not hesitate to ask. I have also copied Doctors Lee, D, Noah, to keep them updated. We're being very proactive. Where did I learn this? From an oral surgeon. They know when they extract a tooth, it's not going to be fun the next day. So we've learned to be very proactive. I also learned this from my veterinarian. When the veterinarian I go to, whenever they give my dog an injection, inoculation, whatever you want to call it, vaccination, I get a phone call, how's Furs doing? They also email me to give me their stool report. I don't get a postcard in the mail. I think that's a high level of care. So this, I guess I saw this patient Friday. This is very typical. And someone last week asked a great question. It's like, who checks all these emails? I don't want to obsess over them. The answer is my staff, could be the doctor on call, could be me, but I always have someone check the emails. And on the upper right-hand corner, this came in yesterday at 10:35 p.m., 10 hours ago. This morning when Stella woke up, her right eye hurt. So she removed the lenses quickly. She said the first time she felt hurt was in your office on 7/28. That was Friday. I told her not to put on the lenses for both eyes. I would like to know your suggestions. You don't need a high-level doctor here to take care of this. My staff is trained. Basically, he said, first thing we do is always thank Stella's mom for the update. It's very impressive now. It's Sunday. And we basically said, since Stella has had discomfort, skip tonight. We'll review tomorrow and set up a virtual rehearsal or review INR because she was in Friday. I checked the lenses. This is probably Stella, to be honest with you, doing this for so many years, tried to put them in at night, 10 o'clock at night, and had all these problems. I know it for a fact. Look how late. If Stella really had trouble in the morning, why is the mother emailing me on Saturday night at 10:30 at night? She tried to put them in. I know from Friday, Stella's struggling with insertion removal. My staff have warned me. All she needs is some handholding. What's most important here is that I responded with expediency, and it's very safe now. This can wait until Monday. This is not urgent. One eye's not red. You guys know the warning signs. If my technician is answering these, he or she knows when to text one of the doctors when she feels there's a warning sign. I have a whole manual of frequently asked questions. There's a finite number of questions patients ask. So let's wrap this up by talking about the follow-up, because again, the party only starts with the follow-up. So just like at the INR, this is true marketing. This is when I allow time for questions. So let's say you enroll 10 people in your program in 1 week, and you feel so good about yourself because you have a high volume myopia management practice. I'm going to tell you, all you're going to be doing is adjusting braces all day. That's the analysis I give, because you're losing a golden opportunity to get those 10 people to refer friends and family. And the reason I know that is because you're not spending enough time with the follow-ups. You're not emailing, you're not following the protocol. We allow 20 minutes. It takes me not 20 minutes to examine the child, probably takes me 5, maybe 10. What takes me the most time is to make sure each parent, when they leave, shakes my hand. Remember, I'm appreciation, I'm respect, and says, Dr. D, and I get this. I know it's hard to believe. Every time we come to your office, we get a very good experience because the experience is orchestrated and it just boils down to time. So during the follow-up, I do visual acuity with and without the lenses. I obviously check each time with and without the lenses. I do the fitting evaluation, but look at number 3. I review with the patient and the parent, are they washing their hands? Does their bag look like crud and their plunger look like Pseudomonas breeding plunger? If I need to change the lens, many of you who've done Ortho-K know this. If you tell them no change is necessary, the parent gets nervous. Maybe their vision's too good. My friend changed 4 lenses. You haven't changed any lens. When you change the lens, the parent's nervous because now their eyes got worse. And sometimes they have. And if I lie to them, again, all bets are off. Then I need to allow time to explain why I'm changing the lenses. I discuss screen time at almost every visit. I discuss your child was yawning throughout the whole checkup. They're 12 years old. They shouldn't be going to bed at midnight or 1 a.m. And I send them information on hormone development during puberty and sleep and how it's related. I talk to them about whatever the conversation took me. I follow up with a standardized system. And that's how I grew my practice. And it fulfills my values. It's security, financial security, but also all the needs of autonomy and fulfillment. And I discuss the importance of outdoor play. Tell me if this is good marketing or good care. This is a standardized letter email that we went over last week to the parents of Calvin. It was great to see everyone yesterday. I am writing to confirm that you do not have any questions at this time. And she copies Dr. Lee, Dr. Noah, myself. This goes out automated. I'm not quite sure how my staff does it, whether it's Nexus or Weave or whatever the case may be. I don't send it out. But what I do send out, in addition to this, is any follow-up email. So for example, if the father comes in and the dad is looking at me like I have two heads, and I say, you know what? Is it okay if I email your wife? And they look at me like, yeah, absolutely. Because usually she has a lot of questions. Oh, yeah, I know. I'll email her. I'll give her a summary of everything. And everybody wins. The mom, the dad, the child, and most importantly, us, right? So we send out this email. This is July 11th. I get about, if we, that standardized email, that generic email that goes out, I would say we send 10 out, we get 2 of these. Yes, hi, I'm confused about my son's eyes. Can you send me some information? Question mark. Can you explain it? By my husband did not understand. So here's where my systems failed. I'm human. I teach this every day, but I'm not perfect, guys. And if you're looking for perfection, you know, it's nowhere on this earth. So somehow the doctor who saw this patient did not follow up because it was the dad. They didn't follow up. Look how nicely we recovered. It was Dr. Noah, right? Dr. Noah is the youngest partner. He's been with our practice 5 years now. He's going on 7, I think. He's a full partner, still buying in. He says, overall, Kelvin is doing very well. His vision is clear. His lenses are working great. The concern is spending too much time on screens and not enough time outdoors. This is him. He wrote this. As a result, his eyes are still growing. In other words, what Noah's saying is, damn it, the lens is fitting well, but his axial length, he can tell, is changing. Now he has an ethical dilemma. He could let it go until this lens needs changing, or he can have this difficult conversation. Clearly, he didn't have enough time during the visit. The goal is to stop the growth, or his prescription might go higher in the future. In order to do this, we discussed adding a medicated eye drop to put in both eyes once per day. The lenses work very effectively in combination with the eye drop. So Dr. Noah has now opened a dialogue with this patient about adding atropine because he knows, and I know, we can't do this in 20 minutes. We have to explain it. You can't get it at CVS. We have to explain it's not covered by insurance. We have to explain the side effects. So we're going to do this virtually, or we're going to set up a different appointment to do that. But you could see how we recovered. I purposely showed you how you don't need to be perfect because no one's perfect. What you need to be human, and you need to be sincere and ethical. And we recovered very nicely on this. And to conclude all this is the number one question I'm getting is, well, how do you hire staff like Hannah and so many others? Well, it wasn't always like that. To be honest with you, we have a crazy staff. We are as dysfunctional as the people in your office. And the best quote I can give you is, culture is caught. It's not taught. If you try to force culture down your staff's necks, it's not going to work, especially in the post-pandemic era. Again, whereas we have all the problems that you have in your practice, but we've learned some secrets. So the first secret is, not only do patients have needs and wants, not only do doctors have needs and wants, but so does staff. And if you don't understand this, you're just going to be constantly losing, hiring, firing staff. Staff's going to be quitting. They're going to go to higher paying jobs or even lower paying jobs. What are staff's wants? They want clear things, stable hours. They don't like when their schedule changes every week. They want a good salary, not a high salary, because we can't give it. That's the paradox with insurance. With insurance, our fees are not increased. Oftentimes they're reduced. But in order to become efficient with insurance, we got to see more and more patients, which require more and more staff. And they want benefits. This is what I view as wants. What they really need, I have learned after doing this for several decades, they want to be respected. If you don't respect your staff, if you speak to them condescendingly, you're just going to rotate staff, and there's a huge cost to that. Number 2 is they want personal growth. I learned this during the pandemic where, like you, salaries went bonkers. And I do yearly reviews, and I'm going to go over that now. If I don't engage them in my office more than just salary, they're gone. So I'm going to talk about how we engage them in personal growth. And bottom line is, I think what I'm best at is community. We are as dysfunctional as your family is, as my family is. You know, you come to my house, it's a crazy house at times, right? I'm sure it is the same with you, but we stay together because we're a family. I need to indoctrinate all my staff members into their office family. So one of the things Barry did, and we started listening to this crazy dentist almost 30 years ago, is he has a Patty Lund's courtesy system. We used to hang it up on the wall. All you have to do, you don't have to learn all these bullet points, but the very first one is speak politely, please and thank you at a minimum, which we weren't doing, because when you're stressed, someone would say to me, Dr. D, they would beep my phone, there's a patient in room 1. I've learned, I say, thank you, Grace, and Grace says, you're welcome. Those 2 words, thank you, are huge, and you're welcome are huge. Just that little kind of tip has really helped the community. When you speak of someone, the second rule is speak as if they're in the room. It's very easy for me to say, oh yeah, my partner, he's a loser. You know, he's never in. I work so hard. He doesn't work. If he's in the room, I'm going to say, you know, I don't think it's fair. I don't think it's fair. We need to come up with a better equitable system here, but the tone is totally different. And of course, use the patient's name. So these are few of Patty's systems that we follow 3 decades later. These are the keys. I think it's a great way to summarize this talk to the 4 keys to keep staff on the long haul, post pandemic. You need a hiring protocol. You need a way to train them. And you need something that clarifies what you expect of them, and you have to review them. So what initiated this talk to you today is I gave a 3-hour talk to very smart ODs to my New Jersey chapter. And I got to tell you, as dynamic as I was screaming, I was jumping up and down. I kind of pretty good at gauging people, nothing. When I ask how many people review their staff annually, I would say a handful of hands went up among 60, 100 people. In us, we have an Amazon warehouse, I think, walking distance. And this really hurt us during the pandemic because we used to hire at a lower scale. And before I knew it, $18 was the starting salary now. So just my starting salary went up about $4 an hour, $3 an hour. So I had to change. I had to become better. And look at from the New York Times, it says Amazon's turnover rate for hourly associate workers is about 150% a year, even before the pandemic, according to the New York Times. The reason I put that in there, salary alone, they got up. I don't know how much they charged, probably about $25 an hour. And you can't just keep people on salary alone. So the first tip, write this down, is you got to hire slowly. Got to hire slowly. And this is really hard because when do we hire? When we're down. We're desperate. And I could tell you, I've hired criminals, I've hired thieves, I've hired murderers. All the time is because I'm an OD, I'm a good OD, I was a terrible business person. Nobody taught me how to do it. I thought because I was a good OD, I would be a good business owner. Nothing could be further from the truth. So you got to hire slowly. You got to fire quickly. I've found if within 3 months, I'm feeling that this staff member is not turning around, we let them go. And I interviewed Dr. Lamb in my Dare to Be Different podcast last week, and she said she had a facility to do that. I have someone similar. I stink at hiring. I like everyone, and I stink at firing. I'm afraid to fire. So who do I get? I have a staff member who's very compassionate, and she does all the hiring. I can't speed her up. I'm saying, Kate, we need someone now. Dr. D, I know I have a few people. I'm looking into their references. Give me some time. And when they're not working out, I say, Kate, where's this new staff member? Wasn't working out. So I'm not involved. Why? Because I stink at that position. You got to solidify your staffs. How do you solidify your staff? You have to have yearly reviews, guys. You need to adjust salaries. And this is so hard when your gross is high and your net is low and you're basing your practice on volume. You need to offer professional growth. And I do a 5-minute huddle every meeting. We're going to briefly talk about my virtual assistants. And one of them, I said, I'm going to be with you in a few minutes. I meet with my staff every morning for 5 minutes. And she goes, oh yeah, that's a huddle. I said, yeah, I guess it's a huddle. We get together. It doesn't matter what we say as a family who eats together. we kind of know we're together. It's like when my wife, sometimes she's leaving out the door, she has a piece of toast in her hand, maybe her coffee. We at least huddle for 5 minutes with us and the kids, especially when they were younger. Same thing there. So that's what I call a huddle, a 5 minute. And a lot of you don't do that because you're too busy, because if you have 20 staff members or 10 staff members, that 5 minutes equates to 1 hourly wage a day times 5. But let me tell you, I've been doing this for over 15 years. I wouldn't be doing it if I didn't think there was a huge return on investment. And you got to orchestrate happiness. I'm not a happy guy. I really not. But what I do know is in order to maintain my staff, I need to keep them happy. So I have many, many fun meisters in my office. So how do I do this? I orchestrate. I bring them bagels every Wednesday. And every Wednesday, it's not from any bagel shop. It's from the best bagel shop that's in driving distance of my office. We have Five Guy Fridays, meaning Five Guy burgers. They love it. This past Friday, I was the only OD. It's very rare. Everybody was out this Friday for a number of reasons. They're watching their grandkids, are on vacation, things like that. I must have seen upwards of close to 25 to 30 corneal reshaping patients of my own. Anybody who's done that knows it's taxing. My staff is not looking forward to it. I'm not looking forward to it. But all of a sudden, just by treating them to Five Guys, and we would have barbecued, by the way, if it wasn't so hot outside, they were just so ecstatic. I bring them gifts every Black Friday. It started 20 years ago when I used to get up at 3 and 4 in the morning, used to go to Walmart or Target or whatever was out there, Kohl's, buy them slippers, buy them this, and I bring it in and they say, Dr. D, you went shopping? I said, yes. I got up at 5 a.m. and I drove to, why? It wasn't the slippers or whatever I bought them, whatever I've done through the years. I've gone to Ulta and so many things. It's because the doctor cared enough to go and get special bagels. It wasn't the gift I brought them. It was, I was thinking about them. And I encourage you, if you don't have that fun meister in you, you need to get someone who's in you. And I say good night every day. And I ask my staff to say good morning to me every day. Remember, I'm respect. Good morning, Dr. D. Good morning, Kate. How was your weekend? Good night, Kate. You did wonderfully today. Or Kate, you know what? The waste paper baskets weren't emptied out. I don't have the energy to talk to you. Can you remind me on Monday morning? We got to see where the system failed. So it's not, doesn't have to be jolly every time. It just has to be respect. The hiring process, I go into in detail, many webinars and many courses. We do same thing. We get them from Indeed, LinkedIn, and we get them from our own patient base. Kate sets up a virtual interview. She gives them an aptitude test, math, customer service. She does an inpatient review. She invites them to observe, and we pay them when they come. We check the references. She does a background check and drug test. I get to meet this individual through somewhere down the process when Kate wants me to, but I can tell you no employee has been in my staff that hasn't gone through these 7 steps. And that's how I keep them in the long haul. When I was hiring criminals and people who had addictions, they looked just like me and you. It's just that I was not good at hiring. There was no hiring protocol. If you don't have a hiring protocol and you grow, and it's not just you and your spouse, then this will happen. Starbucks and all these big companies, they have hiring protocols. I think you need to tell them what you want out of them. So we have training guides. They're called help guides. So when we got the Pentacam, we're training them. Remember, clean topographies are so important. And most recently, this is the third huge tip. When we started hiring virtual assistants, someone who works outside the office. They could be abroad, they could be across the street. I talked about this last time. Some people look at it as inexpensive hourly wages. I don't. I actually look at it as something different. I look at them as a virtual assistant. It's totally focused on the task I give them. They're not doing patient care. Whereas my poor other staff, they have to answer the phone, or they have to do the INRs, they have to be in the room with me. And then in between, they have to do all these administrative tasks like emailing the patients after the visit. That's why we drop the ball. So maybe the virtual assistant is not as efficient, but they only have one responsibility. So how do I train them? So I'm not advocating this program. There's many of them. It's called Loom. It records a screen. So it would be recording me as I use my EMR. So we would say, this is how you log into the EMR. This is, I type in my name and we save it. And we have a library. We have an educational library of videos of how to log into the EMR, how to enter patient data in the exam room, how to scribe in the exam room, how to write emails. So when people say to me, well, who answers all these emails? They were trained. If you don't spend the time training your staff, you're going to get what you put into it. And you got to review them. I'm going to close on this. If you don't review your staff, you've lost. Because I got to tell you, I dread the reviews. Why? Sometimes I have money for raises, sometimes I don't. But the bottom line is, I need to spend time with the patient, with the staff member, to tell them how much we appreciate them. If there's no raises, I have a system for that to say, listen, it has been an awful year. Let's say 2020 for all of us. But you know what? That doesn't excuse how great you were. You came in during the pandemic when we were nervous, or you came in when we were suffering. I can't thank you enough. We give them health benefits. We give them dental benefits. We give them 401k, and we review these benefits every year. I think the reason most ODs and health professionals avoid this is they're afraid. They're afraid they're going to ask for more money, and it happens. But you know what? When a staff member says to me, well, thank you very much, Dr. D, for the raise, but it's not enough. I'm worth more to this company than that piece of paper shows. Do you think I want that? Of course not. But it wouldn't get better. And I look at that staff member and I said to her, you're 100% right. You're 100% right. And I apologize. And I will correct that error right away, because you are worth everything you said. I've corrected that wrong right away, because I have formulas, and sometimes these formulas let down. This staff member, I respected her because she had enough confidence in herself and enough honesty to tell me, yeah, I appreciate everything on that paper, but it's not good enough. And we corrected it. I think most of us dread that hard conversation, so don't do it. So people just leave, and they give you 2 weeks notice if you're lucky. Again, I have barbecues. Every Thanksgiving, we fry turkeys in the office. Sounds disgusting. We've been doing this for over 10 years. People talk about it all year long. We have a chef come in. We have all these crazy things. So when they go home and they say, this office is not perfect, but you know what? It was fun. It was fun. And this is a menu and a hard Friday. Fridays are hard. Nobody wants to be there. A lot of the doctors are off. Some of the senior staff are off. Maybe they're seeing on Facebook that the doctors are at the beach, the staff is at a water park, and they're stuck with me, right? And so listen to what you wrote. We'll be ordering fries in bulk to share, with a smiley face, and everybody's putting down their order for Five Guys. So putting it all together, marketing should be synonymous with exceptional care. Educate your patients before, during, and afterwards. Take time, guys. It sounds so simple, but it's not easy. Correspond with urgency. It's not enough to answer. So that patient that emailed me, she was seen Friday, emails me Saturday at 10:30. I tackled it when I logged in for this webinar. If not, someone else would have. Understand the difference between needs and wants. If you got one thing out of me, if your needs, remember those are subconscious needs, are not filled, then things won't work out. So I've been speaking now for over 50 minutes, 55 minutes. So I want to end with this quote. If we don't change, we don't grow. If we don't grow, in my opinion, we're really not living, and certainly in this author's, journalist's opinion. Growth demands a temporary surrender of security. You got to not be a sheep. It may mean giving up of familiar patterns, safe but unrewarding work. The reason you hear the excitement in my face, in my voice rather, all 3 weeks I've been giving the webinar, is that I am so happy with the way I orchestrated my practice. It feels my needs, my conscious and subconscious needs. You can do that. I'm not this wonder doctor. You're not this wonder doctor. You can do that. It's the decision to make the hard choices, knowing that many of them will be wrong. But you know what? We'll be fine. So with that, I am done with the continuing education part of this program. I just want to tell you, I will be speaking at Vision by Design in September. I think it's the Wednesday during Vision by Design. I have not missed this meeting ever. Why? Because I speak at it, but not always, just recently. I also learn. Every time I go, there is something that takes my practice to a new level. I only have to learn one thing. So I'm speaking at the boot camp. I encourage you to go. It's in Chicago this year. It is not the most convenient, maybe after Labor Day, but you know what? What you learn there will ripple for years to come. And during the workshop, I give my Supercharge course. Many of you have gotten the solicitations and the emails. It has nothing to do with myopia management. I've learned from giving this course almost 20 years is that it's about allowing the doctor to take the time during the workshop. It's one day. I'm going to start around 1 o'clock and I'm going to go into the mid-hour nights until everybody there understands what the heck they have to do to have a wonderful life. It has nothing to do about myopia management. That's just a byproduct. So this is an OD that I interviewed in my podcast, Gina Wesley. She wrote me this card maybe 10 years ago, 7 years ago. Thank you for inspiring me in my practice. Supercharge was far fantastic, but I'm so thrilled by what you taught is applicable to so many areas of my practice. And remember, I'm getting like tremendous accolades and I'm getting pumped up by hearing these. So she came last year and I said, hey, Gina, can you say something about my practice? She goes, listen, absolutely, Dr. D. She says, Dr. D provides you with a map for success in your practice, no matter what path you choose to pursue. In other words, dry eye, low vision, whatever the case may be. It's the best mirror I could have ever asked for, guiding me towards the direction I truly want to go rather than what any vision plan or the doctors or industry may think I should go. If you look at Gina's website, she's hugely successful. Almost all of the practitioners who've come beforehand are hugely successful. They just have made slight pivots to their practice to make it as rewarding. Most recently, I interviewed Dr. Tom Mai. He said during the podcast, Supercharge is the best thing I've ever done at an optometry conference, flat down. It really changed my life. That's what pushes my buttons. I only give Supercharge once a year. The rewards that I get is cards like Gina sent me and so many of you sending me gifts, cookies, expensive scotches. I've got it, everything. It pushes my buttons. But for you, it's very different than, this is not a CE course Supercharge, right? It's all immersion. You sit there and you spend time with the guidance of myself to set fees that make sense for your practice, to set up marketing that makes sense for your practice, and most importantly, to know what's most important. So for listeners of this webinar, any webinar, the recording, I'm giving one $500 discount that will end tomorrow night, the 31st. It's $500. It's the least, the cheapest tuition you will get out of it because you've endured my lectures 3 continuous weeks on a Sunday, and you get a little taste of what I have to offer. I'm offering it on a Tuesday, right after Labor Day at 1 o'clock. I'm going to start. You'll get lunch. You'll get an experience, lessons, and a manual that will last you a lifetime. That's what Supercharge is about. It's not like you're going to keep paying me. You're going to keep doing this. And anybody who's attended Supercharge, whether it's last year or 20 years ago, will let you know. I respond to their emails, their questions with expediency, just like I do. I think this is an opportunity. You got to make time for yourself to come and see me and spend the day with me. You can go directly to the charge for this. It's only for webinars attendees. It's a QR code. It goes directly to the secure account, and you'll get $500 off the tuition. Guys, it was an absolute pleasure speaking to you these past 3 weeks. I see we have some questions. Megan, do I have any questions? Any questions that need expediency to answer right now?
Someone wants to know what your podcast is. Where can they find that?
It's Dare to Be Different podcast. It's on Spotify. It's on Apple. It's called Dare to Be Different. You Google Dare to Be Different, Dr. D Optometry. And I'm so proud of that because I interview many past Supercharge attendees. I have lined up executives in the field, and they're all different. But what they have done, all of them, is they've taken the lessons that I've indoctrinated them in and just blown me away because they designed a life, not a practice, that fulfills their personal and professional values in life?
I think that's it. We can send out some answers to these other questions in an email along with the recordings afterwards.
Very good. Megan, thank you so much for doing this, getting up so early. Everyone, thank you so much. I hope to see you at Vision by Design. Please come up, say hello. Remember, I value appreciation. Come shake my hand. Tell me you gained at least a little bit of information from these webinars. Have a great day.